Oh, it sounds very formal, doesn't it?
Yeah, she's very
Recording.
serious about this. Okay. So we've done our introduction. I mean, if there's any quick question, obviously, if you want to ask, because it's obviously be beneficial to everyone. I don't mean don't ask questions, but if you were having trouble with something and you wanted to go into detail,
But I was just
ask
going
it.
to ask how far Sonia's through her course.
So
Um,
she,
sorry,
sorry,
Holly.
I don't know what I was going to answer for you. It's awful.
So I have done the first block with Holly back in November.
Okay, cool.
So I did the 2 week, well, the 8 day block.
Yeah,
Um, yeah, so my next block is not until April.
yeah, yeah.
Um, but if I'm a bit honest, I'm a little bit behind with my revision. So
Yeah.
Sonia, I'm so
yeah.
sorry. I forgot to say to you, how are you?
That's okay.
I'm sorry,
That's
please.
okay.
I'm not obviously very professional at Zooms. I haven't done them since COVID time. Sonia, please introduce
My
Q1.
favorite bit probably is just seeing how relaxed people get, especially if they go to sleep.
Yeah.
Yeah,
Um, And I think for the reward bit, it's probably the shoulders because, like you said, Holly, you get that little bit of gold, you get the nitty gritty
you're
bits.
pretty much guaranteed, aren't
Yeah.
you?
And for receiving, yeah, same. I enjoy the whole treatment because it's just so relaxing, and I love pressure on my feet.
Mm.
That's that's sort of how I have a bit of a stress release is my feet being touched.
Mm.
Yeah.
Well, you as well. I mean, so Sonia, there was also Angela who is doing the certificate, and another lady, Miranda. So they would have it every day. Well, they had Monday, Tuesday, Wednesday, Thursday, then the weekend, Monday, Tuesday, Wednesday, Thursday. And I saw a huge, well, I don't know, it was obviously intense, and we wouldn't normally recommend it, but
Mm.
it was pretty good. But that's a shame. Is that the last time you had your feet done in
Yeah.
November?
Yeah. So yeah, I've been back in Tom Price since November. I haven't been anywhere. So
Mm.
I've been a bit starved of treatments.
Okay, so before we go on to the revision, which seems be so these ladies, Sonia, have got their exam on the 14th of March, haven't they?
Oh wow.
15th. Yeah, I know.
Yeah.
But
Oh,
they'll be very prepared. But I did also think if you
Sorry.
did want, what was,
That was my laugh when you said we're very prepared.
no, you will be after this Zoom session.
Yes.
And also, there is a backup, if did something terribly happen, you had a complete brain fog, because Sonia and Angela will be taking theirs end of April, isn't it?
yeah.
Last week in April. Yeah.
Okay, cool.
So, okay. So, Solaris Care. Now, I don't know if I mentioned it to you, Sonia and Angela. So, talking about the clinics, when we do 40 hours of supervised clinics, 4 days I arrange, and they're the 4 days in May,
Mhm.
2nd, 3rd, and 23rd, 24th, I think. That's
Yes.
36 hours. So there's still 4 hours outstanding. And in previous courses, I used to take students to Solaris Care and they'd do 4 hours there. But they're
Mhm.
only open Monday to Friday. So I thought, well, that's not going to work for these groups because Solaris is not open Monday to Friday, only open in the week. I thought, well, we can do a virtual clinic because they do that in remedial massage. It has to be a small percentage, but I could do, you know, on Zoom, and you've got people at home, and I just see you set up, um, yeah, and do
Yep.
the treatment and
Okay.
etc. But then when I've spoken of Solaris Care, the cancer support, they're in Charlie Gardner's and Cottesloe. Anyway, so the weekend group thought it might still be, could we still go there, if they could find a date or a time that suits. So anyway, and the same would apply to you, but obviously you're in Tom Price. If it
Yeah.
was thing you wanted to do, you could perhaps arrange it when you come down for the clinic weekends,
Yeah.
a day before or after. So we used to go along and do it counted as 4 hours. We'd actually do three treatments, and they're only like 45-minute treatments. So it's for people and receiving cancer treatment or also their carers.
Mhm.
Um, and we used to do like three, like 10, 11, 12. Get there at 9:30 and finish at 1:30. So that's your 4 hours. yeah, anyway,
Okay.
I've spoken to Cheryl today because the problem is as well, I need a reflexologist needs to supervise you, and I don't really have any spare days
Mm.
to do that. But Cheryl, who is the Charlie Gardner manager of volunteers, she's a reflexologist. I trained her a number of years ago. And I was talking to her today, and she said, well, you don't need to be there, do you, if I'm here? And so you wouldn't need me there.
Okay.
So when she said, well, how many students? And I said, well, I don't know how many are definitely interested. And I said, Friday might be a good day. She said, Friday would be my worst day. I'm just the busiest. They've got four treatment rooms, but she has her busiest day of therapists. But she said she's very flexible. She can rearrange and juggle. And so what we decided would be the best if I just gave you her email. If you
Okay,
were
cool.
interested in arranging something with her, she
Okay.
can, work out the best day. Or if two or three of you wanted to go together, I don't know, maybe, I
Okay.
don't know if she could do three. So it's, yes, and I think that's just the easiest way. Don't need to be in the middle, just confusing dates. And so it's optional. It's not for everyone. Not everyone will feel that they want to, because at Charlie's, I mean, it's a fantastic setup. The rooms are wonderful, and Cheryl's just the best person for the job. But it can be quite confronting sometimes, obviously, and depending on what's gone on. So the other option is to organise 4 hours at home. You can do it in two lots. One client can kind of take 2 hours when you're setting up the room and spraying down and cleaning things, and then afterwards writing your notes and all that. So that is your option. So that's what I'll do. I'll send an email out with Cheryl's email. If you're interested, contact her and then take it from there. But I said this leads me on to the next two Zooms. I've actually want to bring, because I put the discussing cancer, working with cancer, and the one in April, which is too far away. If I bring it to the one in March, because we need to have covered that before you go to Solaris Care. Because I talk about working with different cancers and what to avoid and what not to avoid.
Right.
So the next two Zooms, yeah.
So have you got those new dates at hand then, Holly?
Yeah, well, they're the same dates, but I'm just swapping the content round from one to the other. So the dates haven't changed. So I'll tell you what it'll be then. So so after today, the next Zoom's the 25th of March, and that will be reflexology and cancer, disabilities, aged care, and hand reflex on. We'll do some hand. We did hand during COVID. It was very effective working on our own hands with all that and nearly falling asleep. So just the content, same date's the same, but then if we've had cancer on the 25th of March, you'll be ready after then so anytime from then to arrange. And she said if they contact me and I've got their contact, what I will then do is arrange a time to talk to you. And she said, because she used to come to class and show a bit of what we're about and what we do and show a little PowerPoint. So she said she'll do that individually or with a few of you. So you've had a bit of an intro before you actually go on the day.
Awesome.
Oh, yeah. Okay. Right. Time to get on. So I emailed this to you, Sonia, didn't I? I've given the hard copy to the weekend ladies.
Oh,
This
if you have, I didn't open it. I don't think I've
Oh,
seen
don't
it.
say I haven't done it. I'm sure I did it. It was additional information because I think you've replied to me on it. Additional
Oh,
theory exam info.
was that just the last few days?
Maybe in the last week, yeah.
Oh,
If not, I can just email it to you again.
where's us? No, I've got an attachment, but it's only one page and it's just text, which I printed out. It's this one.
Oh,
The CNS.
sorry, that is the same subject. So the question at the top is why is it important to have an understanding of central nervous
Yes.
system and endocrine system? Sorry,
Yes.
it wasn't very clear. It's not the same pictures, but
Oh.
so that is something that part of the correspondence package, there's a question in the exam that asks for in 50 words or less. And it's really just reading well, you obviously haven't had a chance to look at it yet, but that's included in the exam. Right, what I'm going to go through, there's all your papers. I've marked them.
Okay.
Okay, so the theory paper is in two parts. We've got section A, section B, and there's an 80% pass mark for each section. And so what I've got here is this document in the Zoom package, starting with revision, what is reflexology? So what I'm going to do now is go through all of well, I'm telling you everything that's in the exam, because I think I've said to you before, when I learned and did my teacher training, you can't assess people, give you an exam paper without you knowing what's going to be in it, I think. And then it's obviously up to you to learn it and have an understanding, like that CNS. There is a question on that, and you've got to, it's more of an understanding of why is it important, and if you can understand that and write it in an exam question.
Yeah.
Yeah. Okay.
Yep.
So, what is reflexology? I mean, I'm not going to spend a lot of time on things that we know. I hope you all will know the answer. A few of the questions would have been in that short test you did. I think that was like day 4 or something.
Yep.
So you've all got an explanation of that, haven't you? What is reflexology? So there's two. Yeah, we've got what it is, and then the third one, explain how it works. So what it is being, it's an ancient therapy. You don't need to go into how it works. How it works is the third question, pressure points, stimulating. Make sure you include the body is mapped out on the feet, or there's reflex points on the feet for the whole body, or mirrored. You need to have that connection, and by working them in a specific way, it clears blocked energy, brings about homeostasis, things like that. Number 2, I missed out reflexology pathways. So we've been talking, they again were right at the beginning. We could all name a reflexology pathway and make it interactive. So,
Meridian.
Circulatory?
Yes, circulatory is one. I should have it in front of me, because they're not always obvious. Yeah, circulatory, meridians. What else have we got?
Zones, flow of energy.
Lymphatic?
Lymphatic is a system.
Yeah.
It's almost like systems of the body.
Central nervous system.
The intention.
Nervous system, yeah.
And zones, yeah.
Yeah.
And zone was another. And intention. Someone on the education committee decided to add that. That was only a few years ago. And yeah, it is another way that it works, really, isn't it? With intention.
Do you think you need to list all of those?
No,
In
3. You need to know 3.
So like circulating meridians, lymphatic, and the nervous system, that would be sufficient.
Yeah.
Plenty. Yeah, and I mean, I can only give, if it asks for 3, I can't give you extra marks for 6 or 5.
6, yeah.
I'll just tell you that now.
Bonus points.
Do, and then you're wasting your time and energy, really, because I can't give any more if it's only 3 and you've answered it correctly. Okay, so how it works, history and origins, that would be William Fitzgerald on Eunice Ingham, and zone therapy. So there's one question that quite often people don't, trips people up, is zone therapy. Well, it asks who invented it. Does anyone know off the top of their head?
William
That's
Fitzgerald.
Fitzgerald.
The
Correct.
ENT.
Yeah. ENT, it's around the 1900s. Anyway, so what did he discover or develop? He developed zone therapy, splitting the body into 5 vertical zones on each side of the body, ending in the fingers and toes. It doesn't actually ask, just put in an explanation of what zone therapy is, and then what else do we need to know? The importance, that's right, the importance I think it's worded somewhere as in, why is it important for us to know about zone therapy? So it
Because
doesn't
Um,
actually ask you to explain what it is, but you get points for, that's in the answers. They've given me a tool sheet with the answers, and that's one of the answers, what I just said, explaining what it is. But the importance, what do you, what,
is it
what,
is it because when you know the zones, you know that by treating the reflex within that zone will affect the
correct.
systems in that zone?
And yeah, can affect anything in that zone. Exactly right. Yeah.
and you can use it as a grid to locate your
And that's the
reflexes.
second one. They're the two that they're looking for full marks. Yeah. And that's quite right, so, and quite often if someone has got shoulder issues, they're in the hip as well on that same side. So responses to, so I am going to obviously be going through it quite quickly so you can have a bit of an evening back, but that's because it's recorded, you'll be able to play it through. Responses to treatment, so it may give responses during and after. So perhaps you could all give me one response your client might have during their treatment.
Tiredness.
Yes.
Tummy grumbling.
Yeah.
Bit of flatulence.
Very good. Yes. It's true.
Because it happened to me, Holly, cramps. I had toe
Oh,
cramps.
yes, it did, didn't it? And it does occasionally to people.
Falling
Yeah,
to
and then
sleep. Yeah.
you've got all the emotional crying, laughing, sighing. Yeah.
And
Brilliant.
how many things do we need to list there, do you think?
I can't remember, to be honest. Should I have had the paper right in front of me? Shall I go and get it?
Yes.
Well, just because then I don't know how many of those should we
Yeah.
list?
All
5?
right,
Should
bear
we
with
list
me.
5 or should we list more or?
Good idea.
Good question, Jackie.
Yeah, I'm going to get a toaster.
And then by knowing that, it does take that pressure off.
Yeah, because then you can just go, all right, well, I know those. I can give those answers, or you can there's lots to choose from. But what about if she needs 10? I don't know.
Yeah.
Yeah.
Yeah. No, it's a good question.
No, it's good to know because otherwise you end up learning 10 and you only need 3.
And like what Holly said before.
I don't want to overexert myself.
Yeah. Yeah. You don't need to put those 10 in.
Yeah.
Yeah.
Where did we get to? Oh, the effects.
How many of those? How many points is it?
Sorry, it doesn't seem to be in the correct order. Just bear with me. It's not many. It's like 3 or 4, I think.
Okay.
And I mean, there's nothing that's really wrong. You could say someone talks a lot, someone stops talking, someone, you could,
There's
because they're
lots
not.
of things, yeah. But we were just saying, what about if it's 10 things you have to list? We need to make sure that we're writing enough. Or if there's only 4, maybe we'll just list 5. I don't know.
But it was 3 pathways, didn't there?
Mm.
Okay, I found it. Sorry, 5 benefits. Oh, I haven't got to that yet, but there's
No.
also perhaps you could each give me one benefit of reflexology.
Reduces stress.
Yes.
Better sleep.
Yeah.
Could you say that how it returns you to homeostasis, or is that too
Absolutely. No,
general?
creates, actual answer is creates, well, brings about homeostasis. So there's lots. Oh, sorry, Cindy.
sorry.
Because I can't see you. I forget. I don't
I am still here.
what you
I was
are.
going to say also sometimes it's like that just sense of relief for people as well. as a
Oh, yeah,
benefit.
letting go kind of.
Yeah.
Yeah. But then you've got all the things like improve circulation, improve sleep, improve mental clarity, improve well-being, ailments subside, decreased anxiety, more stable moods. I'm sure you could always just think again, think of your own treatments. Yeah. So 5 benefits. What were the that hasn't found the question wasn't it? Effects.
Yeah, no, the question was about the effects of reflexology during and after.
But after is a bit like benefits, isn't it, in a way?
True.
But it can also be like headaches and
Oh, yeah,
thirst
yeah. Headaches.
Yeah.
and
Going to the toilet a lot,
increase
breaking out in spots. Oh, I don't know why I can't find it. Maybe I've made it up and it was in the and that was in that short test, wasn't it? Look, it won't be many. I don't
That's okay.
that's odd. Maybe maybe it's included and it's not. Right, I'll keep looking, but anyway, there's definitely benefits are in there, which you've
Yeah.
all got lots of. And okay, spoke about Unisingham. That's William Fitzgerald. I lost my. Okay, contraindications and precautions. So there is a question, and it lists 5, 6, 7 like conditions. And there is a contraindication in there. I think it's fair to tell you that because it's a trick question, in my opinion. Am I not actually going over? Oh, sorry, if I've lost. This has just sent me on a spin because the questions in the paper are not the same as mine. I don't know why. Well, they wouldn't be the same, would they? Because we would never usually have the paper in class.
I vaguely remember you saying something about this question, Holly, in one session, saying there was one that just seemed to a little bit tricky sort of question about precautions and contraindications. Yeah, contraindications.
Contraindications. Okay, so I'm actually going to go and talk about now the second piece of paper, the one that says treatment plans, because it is relevant. So there's this question, as I said, 6 or 7 conditions. I don't know, like I'm just making this up. 2 weeks after a knee replacement. That's not one of them, but something like that, or 3 months after a heart operation, or something like that, a condition. And it's saying, how would you, what precautionary measures would you take before? So it wants to know really like your treatment plan, how often you treat, if you would use a lesser pressure, shorter treatment time, if you would see them twice a week with a short time, or and in these questions, there's one that is someone you wouldn't treat. It's a contraindication.
Right. Oh,
That's
so
what
it's a
let's get
it's a
into.
trick one, right?
It
So
is.
when
I
they
just
give you
think
the history, then you have to identify that person you would write, I wouldn't treat this person.
exactly right. So your answer would be, this is a contraindication, do not treat them. And so while we're on the treatment plans, I think we should talk about, I think I might have mentioned it in class, but probably not to yours, Sonia, because it was so long ago. I've seen these guys last couple of weeks ago. And so when they're asking for your treatment plan, they're looking for 3 or 4, you can just put bullet points, dot points. And I would always put 4 to 6 weekly treatments because that's almost kind of like, well, that's what I was taught, and that's what, when people say, how often should I come? I always say, if you can come weekly for the first 4 weeks, that would be great. You'd really see, and then perhaps go fortnightly. But yeah, so between 4 and 6 weeks weekly treatment is a bog standard answer. So depending on what their thing is, so if it was, say, if it was 6 months after a knee replacement, then I would be saying pay particular attention to the skeletal, muscular, especially zone 5 and the knee reflex, which is obvious. Maybe, or if there was swelling, you might say do the lymphatic system. So you've got to address what their condition is. Then I've said before how the association, and there's a whole unit on referrals and where we would refer someone, because in your case studies you need to do a referral letter for 2 of them. And so say it was the knee person, I might suggest he does some yoga or sees a physio or something like that, refer them to someone else. If it was a digestive problem, a nutritionist or a dietitian or a naturopath, or they like you to, they're looking for that to mention another modality. Yeah, I think that's it. Any question? Or you can also tell them areas on the hand they could work, self-help. And anything else you think of? Can you think of anything else? I don't know, if someone had plantar fasciitis, you might suggest they see a podiatrist or do some foot exercises, or so that would all be in your answers.
So that's quite a big
Big
one,
questions.
Holly.
It's a big question. Well, it's got 7 different conditions, but like I said, you only need hang on, it's 7. No, so it's 2 marks for each. 2 marks for each of the 7.
Wow.
And so there's so many different answers that I can. Obviously, when they did it, everyone on the education committee put their answer. And so I've got like 1, 2, 3 different versions.
So in each so just to clarify then, Holly, in each scenario, for want of a word,
Yeah.
they are looking for at least 2, or was it 4 points to describe how you would respond to that scenario?
Sorry, it's worth 2 points each one, but I would in the answers they're given like 3 to 4 bullet points. So for all of them, really, you could say you would recommend weekly reflexology for 4 weeks or 6 weeks. You would recommend they go and see someone else, like I said, yoga instructor, a physio, a dietitian. You would work that area depending on what it is, their neck, or if it's their digestive system. You just actually pay particular attention to the digestive system, work it extra. That's 3, was it?
Yeah.
Yeah. So that would get you the full marks. You might have some, I mean, one of the ones for indigestion is healthy eating. It's a bit of a
So referral, work on a particular area, recommend 4 to 6 weekly sessions.
And then one other thing, and that should get you the 2 points.
yeah, but those 3 points would get you everything.
Yeah.
But if you really, I mean, I have to, because they've, or you might say, so when would be a time when you might initially say 2 short treatments in the first week, 20-minute treatments?
If
Do you
they've
think?
got like intense pain.
I think if someone was really, really unwell, or a child, for instance, would only have a short treatment. If you think it's like a full hour's treatment might be too much, you could suggest that. And it's not wrong, really. Apart from the one you could get completely wrong is the one that's the sneaky contraindication.
That one that you should not treat.
Yeah.
So once we identify that one, then we can just
Yeah.
go fold on the others. Yeah.
That's a good idea. Look for that one first. It is a good
Yeah,
idea.
look for that one. Know that
Yeah.
one.
Get that one out the way.
others you can fill in. Yeah.
And someone said to me as well about going through the exam paper and looking. So each question will tell you how many marks, and just flicking through it first, and so you know what's ahead of you. And
So it'll probably be something like either someone with deep vein thrombosis or someone in the early stages of unstable pregnancy, or one of those
Yeah.
kind of scenarios.
One of the contraindications,
Yeah.
that we have covered in class.
Yeah. Good.
I mean, and some of those in that question we just had are not. You may think they're precautions. What would you think you would be cautious of?
Epilepsy and diabetes.
Yeah. I mean, there sometimes, if someone was having lots of seizures and things, and I wouldn't give them a full hour's treatment, I don't think, to start. I would say, well, let's do 2 half-hour sessions for the first week and see how you feel. So it is
Yeah.
relevant. Yeah, precautions. Someone on very elderly, on lots of medication and frail, you might say, would treat with caution, shorter treatments, lighter pressure.
Mm-hmm.
Okay. I'm just making sure that's not Angela messaging me. Excuse me. No, it's not. Okay. So I think, yeah. And no question, no. Obviously, you'd ask me if you had questions. Okay. So with that, actually, contraindications to reflexology. How about you give me 2 each? Can you do 2? Or let's start with 1 each.
Oh, the obvious one, the DVT.
Yeah.
A fracture in your foot.
Yep.
Um,
Mm.
I've gone blank just now.
The early
um,
unstable pregnancy.
Pregnancy, yeah.
Yeah, I think that's a contraindication, isn't it?
Mm-hmm.
Pacemaker, is it?
that's a
No.
precaution.
It's more of
Yeah.
a precaution.
I think an infectious
that-
disease of the foot.
Infections of the foot or
Infections.
infectious diseases. If someone had
Yeah.
someone had COVID, I would
Yeah, a
treat them.
fever and temperature of whatever.
Fever, yeah.
Possibly unwell.
Under the influence of drugs or alcohol.
Mm.
Yeah.
Fever or temperature, did we say that?
Yeah.
Yeah, we said
Mhm.
temperature, fever.
Yeah, I think we've had lots.
Yeah.
Well, they're all in anyway. There's listed, aren't they? We did it way sort of early,
Yeah.
maybe day 2 or 3.
Yeah.
All that time ago.
Gosh, that seems like such a long time ago.
Mm. So how many each will that be? How many do we need to give, Holly?
You need to know 6
Yeah.
contraindications.
Okay.
And you don't actually need to explain why, but obviously you would know why.
Okay.
And then 6 precautions, is it?
No,
No?
no, you might use precautions when you're doing the question previously.
Okay.
There'd be more precautions there, but no, that 6 is quite a lot, isn't it? To
Yes,
so
I
we've
think
had unstable pregnancy and first trimester. They're both, so that's 2 points there with pregnancy.
Okay.
Okay.
1, 2, 3, 4, 5, 6. Oh, yeah. Okay. Under the influence. Drugs. Good.
Sorry, there's bones of the feet. I was going on. Was that okay? Did someone have a question?
I was struggling with that, but I worked on it and I've got it now.
What, the bones?
Yep.
Oh, good
Brilliant.
job, Jackie.
Yeah. It was just kind of, I wasn't going in. So I whited out all the words
Yeah.
and then photocopied a whole lot and then just sort of like tested myself so that I have got that now. So,
Brilliant.
That's the only advantage of being a radiographer.
Ah.
You knew them. Oh, you've already got the.
There's only one advantage, and that's
Yes.
It's a
bones.
horrible question. I really think. I think if I asked, I'm going out for dinner tomorrow with 6 reflexologists. I'm sure if I whited it all out, perhaps I should do that and ask them to name them all. None of them, I'm sure, would be able to.
Oh, Holly, you've just reminded me. I still haven't completed my anatomy and physio? Do I need to do that before the exam or
No, just by the end of the
by the
course,
end? Okay,
end
cool.
of May. Well, 20. Because I was end of the course.
Okay, cool. Thank you.
Okay, so we don't need to talk about the bones of the feet anymore. Biomechanics, the importance. So we did a little bit of this in class when we were walking along and watching our gait. I don't know if you remember.
Yeah.
Mhm.
I found,
Oh, excuse me. Sorry.
backpedaling, I found the question on responses the client might exhibit during a treatment. You need to know 4 of them. Sorry about that.
Okay.
Oh, you found the answer. Yeah.
I kept looking, couldn't see it. I can't found the question. And
Effect.
there's also another one, 6 responses they might have after a session.
So,
Sorry, is that the
You all
same? Sorry,
Isn't
you
it the
just said
same?
response. Is that not the same question?
So responses during,
Oh,
so that
during.
could be the sleeping, the flatulence, the laughing, crying, yawning. But I mean, a lot of those, laughing, crying, you can have after.
Yeah.
Sweating, mood change, pain reduction, mental clarity. Yeah, there's lots. So it's 4 during and 6 after. So I'm sure you'll get it.
And then 5 benefits, is that right?
That's it. Yeah.
Okay.
So biomechanics, I can't find the question at the moment, but tell me what you know. Why is the question, I'm sure, is why is it important for us to have a knowledge of biomechanics of the lower leg and foot?
because it can distort the foot and it can cause pain, and it'll explain why there's tender reflexes.
Yeah. So those are all because again it just asks for bullet points. So it can so if their foot is twisted or whatever, I see it all the time with my clients with cerebral palsy if they're walkers, and one part of the foot might be, really calloused because it's not flat on the ground. So distort the foot and then it can put pressure. That would be one. And then put pressure on, say, the zone 5, the shoulder and the down the whole zone 5 because of that's the way the foot is. So put pressure on those reflexes. And so what's the word I'm trying to think? It's it's not giving you a true representation of the reflex. I didn't make that very clear.
So you said it can cause pain.
Absolute pain. I didn't.
May explain body pain. Yeah.
Foot distorted. The foot can put with a distortion that can put pressure on, for example, zone 5 due to how that distortion is.
And that caused body pain. So say you were leaning right on the zone 5 and the hip and then in the body. Yeah. Could be represented.
I think that another list that you had given us before, it says awareness encourages referral.
Well, again, awareness to the client, and so they're all acceptable answers. But you want to know how many you need, don't you?
Yeah. How many points we need to raise for each thing.
So we want 3 reasons. That's all right, isn't it?
That's not bad. We can do that.
Can do that. So foot health. If you had a client that came along with tinea pedis or athlete's foot. And so they've actually arrived, taken their shoes and socks off. What would you do?
It would depend on how much of it there was. If it was just one little small spot, you could just cover that one spot and then
Yeah.
just avoid that area when you're treating. Give them the option, obviously, to come back once it's cured and tell them how to fix it.
Yeah.
Because
Make
if
sure
it
you,
was,
sorry, make sure you tell them. They want to know, they want, you
yeah,
know, if
that's
they're
what
not,
it is. Yeah.
because make sure you tell them it's very
Contagious.
contagious.
Mhm.
They might not be aware that they've actually got it.
Yeah, so advise them. It is contagious, yeah.
Did you say, would you put a little band-aid or something over that spot or not really?
Yeah,
Yeah, you
definitely.
could.
I would.
Yeah,
If it was in an area that you could.
yeah.
Yeah, if it was like between the toes though, you can't really put a band-aid in there, can you?
So you could just avoid that. Yeah.
Avoid
I
it,
have
yeah.
it
Yeah.
at Rocky Bay sometimes. If it's very tiny, I just avoid it.
Yeah. And obviously you're using very good hygiene practices, so
Have
you're
us.
going to be spreading it. So
Oi.
If it was all over the foot,
Just wouldn't
Exactly.
bit different.
What would you do then, Cindy, if it was rife?
I'd be saying, for goodness sake, what's going on with your feet? No, I wouldn't. Oh, just
So
advise them to
again,
rebook.
yeah.
Mm.
It's all the same advice, however is because there may not actually be, not everybody knows they've got that, which is all over their feet. So
okay, so they want 5 considerations.
You
Or
can,
yeah, sorry, Sandy.
oh no, you can also tell them to use like a fungal cream or tea tree
Mhm.
oil. Tell them to keep it aired and dry. Wear thongs if they're out in public.
Yeah, that is one of the answers, wearing thongs. Yeah, make sure they're aware. Tell them how contagious it is. Try, tea tree, whatever, or go to a pharmacist, go to a GP. Hygiene, keeping it washed and dried, and so 5 of those. You could say, I'm not treating. It's a contraindication. If it was small, you could cover it or avoid it.
for
So that's
each
it.
one, for small spot and for large area, we need 5 responses for each.
No, any of those 5, any of those things, 5 of any of those things. So you could list, if it's a small area, you could cover it up and avoid it. If it's well established, I would not treat them, contraindication. Tell them it's very contagious. Tell them to see a pharmacist. Tell them to wear thongs. Tell them to keep it dry, and
Keep clean
I
and
think that's
dry.
enough. Yeah. So just 5 sort of points, things to be aware of, including advice, precautions, and reflex areas to work. Well, that's a bit of
Yeah.
You could use hand reflexology.
instead, absolutely good answer. Yeah. You could do 1 foot, 1 hand, or both hands.
Mm-hmm.
Okay, so when would you use hand reflexology? That goes on nicely. Can you each give me a time when you might use hand? Well, you've already said yours, Jackie.
If there's
Bro-
an injury,
Sorry, I didn't hear you.
who was this?
Who-
You want to go, Sonia?
I was just going to say a broken bone.
In the foot. Yes, absolutely. Broken foot, toes, do hand. Yeah.
If it's a patient's preference, they don't like their feet being touched.
Yeah.
And if it's inaccessible, like you're at work and you can't exactly haul your foot out and start rubbing it.
No, it's good to do if you're doing demonstrations or you're doing expos or Good.
How many points would that one be? How many points do we need to
There
list
you
that?
are. I don't know, yeah. I hadn't sort of given, I don't think I've ever given the points before. And so,
I like how Jackie's on our point system here.
yeah.
Because I've written down 4, but I just want to make sure that that's going to be enough. Like otherwise, I'm going to write a couple
Oh,
of
it's
more.
the very last question, I think. Is it?
Yeah, could it also be that sometimes a person might just, planning to have obviously their foot reflexology on their feet, but then due to, I don't know, things that have happened during the day, or they go, actually, do you know what? I don't want my feet being done, but can you do my hands instead?
Yeah.
There's an option.
Yeah, that's what Sandy said. She said patient preference. Yeah.
Yeah, yeah. Because things happen for people every day.
Yeah, I
Don't-
had a lady who worked up in the mines, in the kitchens, and her hands just used to get so sore and hurt, that she liked hand. Look, I'm sorry, again, I can't find it. And when I do come across it, we'll have to just go back to put
Okay.
how many points. Hygiene procedures. Can you tell me? Yeah, let's go through and give me a hygiene procedure.
Obviously, all your towels that you use are separate for every client.
Clean, yeah,
Clean
clean towels.
fresh towels.
The client's feet should be washed with soap and water or disinfectant wipes.
Yeah, clean feet.
Clean feet.
And you need to dispose of the wipes that you use straight away.
Yeah. Do you
Wash
know
your
what?
hands before you start the treatment, and if you get interrupted, wash them again before you commence.
Do you know what? There's only 3 needed, so we have got easy and above that. We're going to go
Yeah.
for
Okay.
Right.
easy,
Right.
easy. So why do we complete client history forms? Again, we did this. Well, we did this when I set you the assessment to do the
Assignment,
client
yeah.
history forms.
Well, it gives you that picture of where that client,
Is
it gives you a picture of their health, doesn't it? A snapshot.
yeah, exactly. That would be
And-
one point.
It's definitely will just let you see if there's any contraindications or precautions.
Yes,
So you know
exactly
whether
right.
it's or not. Yeah.
Yeah,
It's also required legally for
yes.
legal reasons.
Required by it's part of their code of conduct for the Reflexology Association.
And regular documentation allows the practitioner to assess changes. I think that's quite a good one
Yeah.
as well.
Are you reading that? Have you found the?
Yeah, I had made
Yes.
notes on my study notes, my exam points, and they were the ones that you'd told us. So I've put them in my.
Yeah, I mean, because it shouldn't all come as a surprise, really, any of these to you. Because
Yeah.
as we've gone through, I've said this is in the exam, even from day one, which was a bit frightening, wasn't it? Because obviously I couldn't go back and
No.
start. That would be crazy. Okay, again, I can't find. The point, the light in this room, this is my reflex room, it's really poor light. Poor eyes can't
I love the green. Green's my favourite colour, Holly. It's a lovely green you've got
Yes,
there.
oh, you can see the green in the back.
Yeah.
There's only one wall of green, the other is like a
Yeah.
pale green. Oh, I'm going to find it. Is that a couple that we're waiting for now on me?
Yeah. Yeah, but you'll get it. You'll get there.
Does anyone need to take a 5-minute break, do you think?
I might get a glass of water.
People need to nip to the loo or get a drink. It is 7 o'clock.
Get some
We're
more water.
halfway through.
Okay.
Yeah.
I'll
Okay.
just get some
5
water.
minutes.
Yeah.
Okay. Sonia, how have you been going with doing it in a block? Was it a lot to do? It's Cindy speaking without any picture here.
It works better for me because I live regionally.
Yeah,
So it was better to be able to come down to Perth and do it all in one hit.
yeah,
But I have found that now that I'm back home on my own,
yeah,
it's a bit harder to motivate to then just keep up with practice and revision and taking in all of the information. So maybe if I was doing it spread out a bit more often, that would be, that might have a better end result. But logistically, it works better for me to do a block.
yeah, yeah.
So yeah, I'm finding at the moment it's a bit overwhelming to realise how much information I've got to take in
Yeah.
when I'm not doing it all the time.
But Sonia, feel free to I'm happy to share my email or my
Oh, thank
mobile
you.
number. We've got a little WhatsApp group
Okay.
called Feet Friends, I think, or
Yeah.
I forget, yeah. And yeah, you're more than welcome to, join us if
Oh,
you
thank
on that
Thank
group.
you.
So because it's tough when if you suddenly, it's hard being remote, like you say, and then
Yeah.
going back into your world.
Yeah.
And so if you want to reach out for anything, don't hesitate to do
Oh,
that.
thank you so much.
Yeah, that's all right.
So how often are you guys doing it?
Well, it was like near enough, maybe once a month from last. When did we start, Jackie? Was it about
So
August
this
or-
year we've only just started back January, so end
Yeah.
of January. So we've only been twice, haven't we? Yeah.
Yeah.
So how often do you do it, like once a month
It was
or?
along once a month, but then our last session last year was November, then we didn't come back together again until January.
End
Oh,
of
okay.
January. Yeah. So
Yeah.
that was the
And,
second session. So then, yes, it was. And then it's only like, I think it's only one weekend each
Yeah.
month.
Okay.
yeah.
One weekend a month.
Yep.
Roughly, but
Yeah.
then when it's the clinics, it's 2 weekends in the May, but
Yeah.
generally it's that. And then obviously we just got to keep doing all the prac and
Yep.
keep doing that because that makes the difference, I think, because the more you do that,
Yes.
it all sinks in, right? So then all these
Yes.
questions aren't quite so overwhelming because you kind of already know it because you've been treating and
Yeah. And that's what I found when I was doing the block and it was all very fresh. I was doing it a
Yeah.
lot, and I've kind of had a bit of a hiatus because the people that I was using for my prac, because I live in a remote town,
Yeah.
over Christmas a lot of people leave.
Yeah.
So the circle of people that I was doing, which are just my close friends, they
Yeah.
hadn't been here. So they've literally only just come back from like overseas trips and stuff. So
Sonia, I remember because I work full time and there's a lot going on in my world sort of thing. So
yeah.
I was feeling a little bit stressed when we all met together in January because, like, for example, Sandy's done great guns. She's done all her casework. I'm like, oh my
Oh
God,
wow.
I haven't started yet.
Yeah.
And I think Jackie's done quite a lot as well. But I remember saying to Holly, oh, I'm feeling a tad bit stressed. And she went, Cindy, you're not to be feeling stressed to doing a course like reflexology. And she's right. And at the end of the day, if something happens, so I start my casework, I've got 6 clients over the next 6 weeks starting this
Right.
week. And but then people's lives get, things happen in people's lives and
Exactly.
like that. But at the end
Yeah.
of the day, if something happened and they're not all done by the 1st of May,
Yeah.
it's, no one's telling me to do this course. This is my choice to do this course.
Exactly. Yeah.
And if it means there's a slight delay in the qualification, if I haven't, I feel confident that I will have that all done for sure.
Yeah.
But if
Yeah.
something happens, because life does happen,
Yes.
that's okay. It'll just be a little bit longer.
Oh,
And then, as Holly said before, we've got this exam in March, but then there's
Yeah.
another one that you'll be doing, and Angela and whoever will be doing in the April.
yeah. Yeah. You can resit if you want, if you need to.
Yeah. But Holly's so supportive and helpful.
Well,
you know.
yeah, I think that's made the difference for having Holly and knowing that it's quite
Yeah.
personal. So I
Yeah.
know that if I'm not done, it'll just be a matter of when I can complete
Yeah.
casework and stuff. But
Yeah. But honestly,
Um,
feel free to connect with us, and yeah, I'm
Thank
happy.
you.
You need
Yeah, and Angela and I, we're on the WhatsApp with Holly as well, but
Okay.
she's the same. She's sort of flipped between Perth and Broome, so she has a
Right.
bit of a dual life, and she does
Yeah.
other things. So we, yeah, we're the remote people.
Yeah. I was up north with some work a few months, in July last year, and I went
Okay.
to Karratha,
Oh,
Wickham, and
yeah.
Cockburn,
Yep.
and whoa, that was very
It's different, isn't it?
different world. I work in
Yeah.
community services, so it was really different. We went to the prison. And
Wow.
the prison who support the team that support the prisoners on, and it just opened my eyes to
Yeah.
regional. I've been to Geraldton a few times, but opened my eyes to regional
Yeah.
community. So I think good on you for doing this. There's a
Yeah.
huge,
Well,
yeah,
eventually my aim is probably to take this more mobile because I'm planning to leave where I'm living and go traveling in my caravan.
oh right,
Um,
exciting,
and then eventually I would end up back down in Perth, but I don't know how long that would be. So yeah, my sort of aim is to be mobile, maybe not as a just dedicated to reflexology, but
yeah,
have that option to do that on the road while I can, possibly.
yeah,
That's a
yeah,
brilliant idea.
Yeah, and it's a very small town that I live in, and I have a small circle of personal friends, and
yeah,
I'm not brave enough yet to just branch out to just do anybody as a
yeah.
case study. So I've limited myself that way, but it's just that confidence thing. Um, and I think that's what I've been struggling with the most is feeling a little bit like, am I a reflexologist?
Yeah, yeah.
Yeah.
Nearly
But
halfway.
Yeah, nearly.
I heard when I was in the kitchen, Sonia, we can have a chat, shall we? And sort something
Yeah.
out because we can, I've always said we can extend, don't have to have everything done at the certain
Yeah.
time. Obviously, I've got a set dates, otherwise I can't
yeah,
just have a course with
Oh, absolutely.
whenever.
Yeah. We'll
But
yeah,
we can
have a
be
chat
very
about that.
flexible. And maybe, I don't know, maybe with now that Angela's in Perth,
Yeah. I mean, I know she still
you can
does go
come
back to
down,
Broome. She goes
bring
back
it.
and forth.
Okay.
So maybe that's what's happened for this hookup. Maybe she's got
Because
a
it is
commitment.
such a long break from you from November, and you don't come back to class till April. So if
Yeah.
we book something in between, I
We'll
don't
see.
know.
Yeah, we'll
But
see.
yeah, let's arrange a time. Are you off work at the moment or on?
Oh, I go back tomorrow. So
Oh,
I'm
what
I'm
for?
at the end of my big break. So I go back tomorrow for 8 days. So I'll be
Okay,
off from
yeah.
the 27th. I'll be off for another 3 weeks.
Oh well, let's find a time then, shall we?
Yeah, yeah. Well, I'll email.
Yeah, perfect.
Cool.
Okay, so the client health forms, that's what we were looking for, weren't we? How many points? 4 points. So really they're looking for four marks you get, so 4 points. So it's a requirement from, the association. It gives you as you said, Cindy, a snapshot of your client's health. It allows you to write progression. You look way back. Oh, 6 months ago, you weren't sleeping at all. Can't remember the others. What else did you have? You had everything.
Legal.
there might
Pardon?
be some contradict. I find that,
Indications. Exactly
yeah,
right. They might say, yes, I have blood clots or DVT. Okay. So 4 points for that question. Essential qualities for a relationship between, I mean, there are a couple of, there are things perhaps that we haven't gone through in class. Because to me, so if I asked you what would be an essential quality to have a relationship,
Confidentiality.
yeah, it's one.
Trust. Is that the same thing? Maybe.
Yeah.
No, trust is totally, I think, different. Yeah. Well, it'll get you two. It's 2 points anyway, 1 point
Yeah.
each. In my
I think you need to be authentic as well in the work, because
yes,
if you weren't
absolutely
in the work,
authentic.
Empathetic and compassionate.
Yeah, good listener, listening skills. Yeah, all of those. You're going to ask me how many, aren't you?
At least we're predictable.
Yeah.
I should have been looking while you're all giving the answers. You could give me a couple of points for, so 3 points, or there's 4 of you, maybe 4. The last question, why is it important to have an understanding of the central nervous system and the endocrine systems?
Mm.
I should know that.
I've just written down that they're both connected and responsible for sending messages to the rest of the body.
Mm-hmm.
I think I wrote the central nervous system is a fast response and the endocrine system is a slower, longer lasting response.
Response, yeah, that's right, as chemicals, and then the central nervous system is
Electrical.
through the nervous system. Yeah, yeah, yeah.
Sorry, say that one again. So the central nervous is the faster one and the endocrine is the slower one.
Yeah,
Yeah.
slower, longer lasting effect. Yeah.
Yeah, because it releases all the hormones, the chemicals, and they're slower, longer lasting. But they work together, the two systems, central nervous and the endocrine.
And then sometimes if you know what's wrong with, like if you find something wrong with the one system, you'd know that it would impact regions on, like parts on the other system too.
Mm-hmm. And also then going along the spine and working the area. So say someone had asthma, you'd be working particularly that spine in the thoracic, that area, because the nerves feed the lungs. So if it was the bowel, particular attention down to the lower back because the nerves from there feed the bowel, you know.
So that's all the connections, isn't it?
Yeah.
Yeah.
Connections. I think it's at the end of the day, with tests or exam papers or however you want to call them, I think, and I'm sure we talked about this when we had that first little paper that we had to do in class, Holly.
Yeah, yeah.
I think so to share with Sonia, I think I know for myself, it brought back memories of being in school.
In school. Yeah.
And then your head goes into like you know because you've been learning and you know this information, but it's how you manage that panic of like, oh my God, I'm in a test. Oh my God, oh my God, oh my God. And the brain starts, that's what I found anyway. It's like, what? So it's just being able to relax, I think, and have a go. Do it the best that you can.
Oh,
Yeah,
you can do.
it's a little bit overwhelming realizing how much information you have to retain, I think,
Yeah.
when you've been out of study mode for
Yeah.
years.
Clear the cobwebs.
It is.
But it'll come back to you so quickly as well. It's like, you'll be like, oh yeah, oh yeah.
Mm.
Yeah. And I suppose especially because it is overwhelming because it's all in the block for you, Sonia. You're doing the block training. It's
Yeah.
not,
Which I enjoyed doing the block, but that's what I'm saying. It's a big time gap between regular exposure, but that comes back to me and me choosing to either do it or not do it. So
exactly, because when we thought about coming monthly, I think you said my travel was going to cost more than the course.
Yeah.
So
Yeah.
that wouldn't work. Okay.
yeah.
I say so relationships. So you only need 3 essential qualities necessary for your relationship. 3 is fine. Self-help techniques you can give to clients. So we questioned this, Karen and I. We didn't like the answers it said. And so I have got a bit of discretion because the person who's answered, anyway, so give me some examples. Could you all give me one thing you might say to your client afterwards?
Drink lots of water.
Water, yeah.
Yeah. Drink lots of water.
Get lots of rest, sleep.
Exactly. Take it easy.
You can show them some relaxation and breathing exercises.
You could do, yeah.
A light meal after, not big
Yeah,
heavy meal. Yeah.
that's not a wrong answer. No, yeah, light meal. But and then specific to what, if they've got a sore neck, you might show them neck
Yeah.
reflexes on the hands. You might show them the point on the hand. I know you haven't learnt the hand yet, but and it wants you to three. Did I tell you that? 3 self-help
Yeah.
techniques.
Rest. Exercises was that one of them?
That would be as well. Foot exercises, rolling a ball, golf ball under the foot, stretches. Obviously, depending on what, but we have to be careful that we can't
Overstep what we're actually advising.
Yeah.
exactly within our scope of practice. Okay, the importance of a code of ethics. And I found the question, so it only needs 3 reasons why, but I'm sure you could all give me one. We could have 4.
It makes sure that each practitioner maintains their high standard.
Yeah.
That's necessary.
And it
Yep.
protects the duty of care to the patient.
Yeah.
That you are not somebody that's going rogue and saying that you're a reflexologist, but then,
Yeah.
if you know what I mean, yeah, just going rogue.
Yeah.
And ensures that you're keeping the client records as well.
Yeah.
That's one of the
Client
answers.
records,
Yeah,
yeah.
so fine. You haven't, yes, sorry, it's harder for you, Sonia.
Is one of the answers to do with insurance? To make sure you're covered as a practitioner
Yeah,
from insurance? That's why you practice the code of ethics, to stay within the guidelines for insurance purposes?
not so much insurance, the guidelines of the association. I see where you're coming from.
Okay.
So, yeah, working within the guidelines of the association.
Professional conduct.
Yeah, it also
Yeah.
protects the public as well, doesn't it? The code of conduct protects the public is another answer.
Yeah.
So there's some questions now on the business unit, which again, I know we haven't covered. But I think they're kind of, I think you could answer them anyway. If I said to you, what costs would you be aware of when running a business? Let's see how many we need. Some of them, yeah, okay. 4 ongoing costs, easy peasy. Maybe I should ask Sonia to start because she always gets the end one.
Yeah.
And then everyone's got all the
Harder, yeah.
one thing you need to consider running your business.
Costs to be aware of running the business. So I guess consumables like your lotion, your
Yep.
wet wipes,
Yep.
towels.
Linen, yeah, all of that. Perfect. Anyone else?
Your insurances, like your professional and
Yeah.
public liability.
Yep.
What did you call it, Sandy?
Like your
Insurance.
insurances, your professional insurance and your public liability.
Yep. And memberships costs.
Yeah. And like ongoing training and CPD sessions that you have to
Yeah.
do.
Cindy, you got any?
Membership. What was that last one, Jack? Sandy, CP.
Yes.
CPD, it's like your professional development.
Oh, okay. Professional.
CPD stands for continuing professional
Oh,
development.
continuing. Okay.
So you've got maybe
Um,
rent if you. Oh, sorry, Cindy. I've just
yeah,
over. I thought you said something. Go on.
yeah,
You
no,
didn't
that's all
say
right.
yours.
Well, yeah, there you go. If you're renting a space,
Perfect.
you've got your
There you
overhead
are.
costs,
You
or
got rent.
if you're like me, planning to have a little studio, I have to invest in the costs of, creating a space, for one of the
Yeah.
words.
You've also got your furniture, equipment,
Yeah.
chairs, stools,
What about
taxation,
what about
accountancy.
what about advertising?
Yeah, absolutely. Marketing, advertising. Yeah. So only need 4. We easily got 4 without thinking too hard. So again, this question I don't like very much. It asks you, I think it's ticking. It's got a whole list. Tick which ones would apply, you should be aware of when running your business.
What is it called?
Consideration. No, what are we doing? Costs.
So we've just done
Consideration.
costs.
Sorry,
Considerations.
we've
Yeah.
just done costs.
Yeah.
Considerations when working out your charges. So, for instance, they have worked it out as a procedure. I think just some minds are more work out that way. So, if I say to you, how much are you going to charge for your treatment?
Service, yeah.
You might want to. Well, the way they've looked at the answer is, if I think, well, okay, I want to say that might be a bit far-fetched, giving up your full-time job. But there was a course, and a couple of people were working part-time in retail, I think 2 days a week. And they said, well, I want to stop the 2 days a week retail. So what do I earn annually for those 2 days? I want to replace that. So they had an annual sum. I don't know what it was. I don't know, say 25,000 or something.
Yeah.
And that's over 12 months. And then they had to work out, well, I'm going to have at least 2 months holiday. So that's over 10 months. And do I want to work every day? No, I'm only working Monday to Thursday. So how many days? Okay, so how many clients? And, work it down that way. So I need to charge whatever it was, $85 per treatment. So that's, when you come to this question, that is the mindset of
That's the answer that they want. They want you to think about it like that.
yes, that is
Not say something like you'd be charging according to your experience or according to, your,
Or the local markets and
Yeah, that's what I would have thought in that. So that's quite interesting when working out your
okay.
charge.
Sorry. So those answers are absolutely very spot on. But that's not the question. The question in it, and it does a load, and it says tick which ones you'd take into consideration when working out your charge.
Wow.
And so it's got them there. And so that's the mindset, like I said, of work. That's what they've thought of. Right, I need to earn X amount per year. I'm going to work so many days a week. I want to earn that amount per year. Yeah, that's the way the question.
Do you have to figure that amount out and give
Not
a
at all.
mathematical
No,
answer? Just
no,
your
it just
mindset of how
lists
you get there.
things. It just lists, weeks of the year, days of the week, hours of the work, clients per day, projected income, gross income, desired income. It's a bit of a very silly question, if you ask me.
Would you tick all of those?
Yes.
What was that, Jackie?
I said, would you just tick all of those? Surely.
Yeah.
Yeah. Yeah. They all. Okay. Good.
Very good.
Yes.
So, importance of self-care of the practitioner. I'm sure you could all give me one reason why it's important to take care of yourself when you're giving to others. I'm going to ask Sonia again first. Sorry, Sonia, I'm not picking on you, but I just want you to have the choice rather than get the lucky last.
I guess so that you can be the best that you can for your client, so that you're in a good
Absolutely.
balanced state to
Yep,
give a good balanced treatment.
yep, absolutely. Perfect. or like, running on empty. You can't give if you're running on empty, or you can't give a good clear out. It's not as easy, is it? How many does it need? 3. Because
I think it's really important. I think it's really important to have time for you. We're giving, so that self-care, like for myself, for example, I enjoy to have a walk along the beach in my bare feet. So I may, if I do 2 or 3 case studies in one day, then some time out, or it might even be just when I take my dog for a walk, just time out away from mobile phones, away. So I just think it's really important to look after you as well. Time out for you.
absolutely. So one of the so I would give you a point for that. You wouldn't need to make it as long.
Yeah.
But
Can you say that it's important because otherwise you won't be able to sustain like your practice? You'll end
absolutely,
up out. Yeah.
Someone said on at this point, our hands are our tools, and so we want to need to take care of them and not wear them out.
Yeah.
And so life balance, obviously taking care of ourselves and practicing what we preach. I can't believe that there's some reflexologists that don't have regular reflexology. I don't know how they can. Well, unless they're having other things, I suppose. Maybe if you're having massage and I don't know. Anyway, sorry, I digress. So that's
Holly,
very important. Yeah.
Holly, would you not also, we've got our colleagues together now on this journey as well, that, having those friendships with, fellow reflexologists to be able to sometimes, not breaching confidentiality, but just to be able to debrief sometimes if you've had a situation that.
Oh, absolutely. Yeah. Very important.
I feel
Or
like
even just
that's going to be a hard question to answer because they all sort of sound the same,
Yeah.
don't they? How
I agree.
like, if you want 3
okay,
points.
so three reasons why self-care of the practitioner is important. One, if you can't give if you're running on empty, if you're not looking after yourself, you've got nothing to give.
Yep.
And you'll get sick. 2, it's important to, it is similar, isn't it, to work out life balance, I think, and to set a good example to your clients.
And to sustain it, I don't know.
And to look after your hands. I think you could put your hands are your tools there. You don't want repetitive straight RSI and
Okay, thank you.
Deformities. I think just ask for 3 foot deformities. I gave you this. You've all had this sheet, haven't you? And it's got 5 examples. I think it's got bunion and clubfoot and hammer toes. There's a few different ones. It just wants 3. You can choose your own if you want, and it only needs a few words to explain. So, for instance, if I said a bunion, and I would just put inflammation of the bursa joints, that would be enough. Hammer toes, toes gripping the earth or tucked, just trying to describe toes. I'm trying to find the answers here.
And clubfoot is when it turns inwards and downwards.
Yep.
And it's a congenital condition.
Yep.
Would Holly, pronation and what's the opposite one? Are they considered deformities?
Yes, they are. For this exam question, yes. So pronation when the foot is rolling inwards onto the medial side. Supination when the foot is rolling. Can't see it. I'm doing it all with my hands. Yeah. So, a high arch. And literally someone said, well, how do you explain that? And you have to write
Oh,
where the
yeah.
arch is high,
Yeah.
you know, and the
Yeah.
same with the flat foot, where there is the arches, there is no arch.
There's when flat foot's described as when the foot pronates excessively, so it's flat pronates excessively during stance
Yeah.
and gait. Mm.
So that's 3 of those. We've done the biomechanics one, haven't we? Sorry.
Yeah.
Yeah, I don't know what page are we on with regard to that. Am I missing a page?
No, I think Holly's moving through different ones, not
Okay.
quite in the order of
Okay.
what
Yeah,
came.
sorry.
It's all right.
Um,
What is this? This slide is to say what, Holly?
the question here is why are biomechanics of the foot? We've already discussed it, having important to the
Done that way.
reflexologist.
Yeah.
We've had all those. Sorry, I don't know why I've had the. When should I do hands? We've discussed time short, traveling, shock. Okay, hygiene procedures. What should we do? So yeah, I'm sorry, I should have flicked through this as we went, I think, yeah. Right, we're going on to a bit more on to treatment plans. We are getting there. You're doing very well. You're not overloaded yet.
No.
Good. Well, don't, it's all recorded, and so you can go back and do a half an hour if it's helpful, set at a time, not the whole 2 hours. So when I spoke about the question and it had 7 different scenarios, how would you address your treatment? And we spoke about maybe length, you shorten it, frequency, pressure, referrals, or if you're unsure, if it sounds very complicated, or you can always say, seek permission, GP permission.
Oh, that's what that means. If you're not sure, if it's a bit confusing, somebody's
Yeah.
yeah.
That's always going to give you a mark because you're asking for them to, see their GP.
Oh, say that again. With GP permission, Holly, what do you mean?
If you're not
So
sure.
when we were talking a little while ago, when we were talking about treatment plans, and I said there is a trick one in there. And so it would say, what would it say? It would give an example, some 2 weeks after a hysterectomy, what would you do? So you might, well, that's a bit tricky, sorry, because that's someone had just had a knee replacement, or if there was
okay.
describing someone and it said, oh, the 1 week after knee replacement, very uncomfortable. It would, you weren't sure whether you would, so you could always say, ask client to get GP permission before starting treatments. Yeah, that's one I've omitted to say when we were going through this.
Cool, thank you.
So now I have gone on to the other sheet that said treatment plans.
Right.
Because it's got some examples we can go through. And just to make sure you're understanding, what they're actually after. So if somebody had, so you don't need to write in, great reels and paragraphs. You can just put dot points, just as on that example, page 1, treatment plans. So someone wakes, upon waking, they have heel pain. You might refer them to a podiatrist. Again, you would still suggest weekly treatments if it was not uncomfortable. You could give them some foot exercises. Footwear is an answer, but I don't know if I would be advising someone on footwear. Well, maybe I would if it was really warm and they were just wearing nothing supportive or,
Avoid
you know,
thongs. Yeah.
yeah. Indigestion, when I said about if you had a digestive issue, you might refer them to a naturopath or a dietitian or anything really. Homeopath is not. And lifestyle, you might say yoga, Pilates. Sorry, that's the back pain. It's getting late now, isn't it? I've done a lot of talking at you. Uh, okay, I'm looking down at the 60-year-old male with so there are a few questions, as I've said, that have got these scenarios. You're working on his feet. The heart reflex is sensitive. See, I don't know if I would mention it. If he says, "Oh, that's sensitive," what's that? You know, what they're looking for in questions like this is that you don't diagnose, and you reassure him, you know, we wouldn't sort of go, that's the heart reflex, you know, like that. You'd say, well, it's a part of the foot and it contains different areas in the zone. It's a part of the foot. It's the whole sort of chest area within reflexology. If it's sensitive, do you have any heart issues? Perhaps you could see a GP if you don't see them regularly. You know, sometimes stress and anxiety can show up in the heart area. I mean, in reality, I don't do this in a treatment. This is obviously for exam purposes. I mean, if they asked me, but I would not come across the chest area because it could be so many things. We had someone on the course once and her heart area or chest was so rock solid. And anyway, she was a marathon runner and that's why her feet were like that. So I wouldn't start. But for exam purposes,
Yeah.
I wouldn't start saying, we want to reassure the client, but always get them to see a GP or if there was something they were concerned about. Remember, you can't diagnose. If someone, insulin dependence, so with regards to people with diabetes, we have spoken about it a bit. There's a few things that we need to be aware of or look for. Can you tell me, let's see how many points they'll ask you for? Have I spoken about diabetes and that the skin can be quite fragile, easily damaged? I'm sure I have. I'm sure.
Their circulation
Yes.
is always compromised, isn't it, for diabetics?
Yes.
Yeah.
Yes. And I mean, in advanced stages, that's where the skin on the foot can become very delicate, easily torn. So you have to, with your pressure doing treatment, you have to be aware and careful.
Yeah.
What else would there be from an insulin perspective?
So what areas on the foot would you particularly work?
The pancreas?
Yeah. Oh, the pancreas being, responsible for insulin. And then if we're working one endocrine gland, pancreas is digestive as well, but I would be working the whole endocrine system well.
When you say that, when you say all endocrine,
Yeah.
would you do them just as each thing, like one after another, or do you do it just in part of your normal process?
No, just part of the normal process, but probably paying more time doing it a few
Longer on
times.
each of those.
Yeah.
Right. Yeah. That's what I
And
that's what I did. That's what I did when I was, treating somebody.
you've had someone,
I've
yeah.
written it in my notes saying, because she's just finished chemo, she's just on immunotherapy and what have you. And so I thought definitely need to do that. And I wrote all endocrine glands, to help. But I didn't know whether that should have been done separate or it's just all part of it, just spend longer on those points.
I think I would just spend longer as I was going through the treatment, but then I would finish with the endocrine balance.
The six, what was it called? The endocrine balance what's
Yeah.
the pro
So when you go and you pump, you're on the pituitary, and the thyroid, and you pump it, and then you join them up, the dot to dot. It was the one of the balances that was the most, we thought, oh, we've only done two. We've still got the chakra one to come, haven't we? So we
Yeah.
did the meridian. So it was not the meridian. The other one where we came down, went back up. I think it was, yeah.
You did the
And I,
spleen. Oh, I remember. Oh, Sandy, you're on mute.
oh,
It's when you gave us that diagram that linked all the
I
little
remember
bits.
now. When
that,
you did that with your hand, I remember now. Okay.
Yeah.
Sorry, thank you.
I have to go and pick someone up at the airport. Can I watch the rest of this on record?
yeah, of course you can. That's late. So we're going to the airport, isn't it? Yeah, absolutely. Of
It's
course.
my daughter's partner comes in
Yeah.
from the spa for late, but and she's
Yeah,
out
I'll
at
just
the-
email the recording
Okay, great.
to everyone. It probably
I
might
don't
take
have
a
to
day.
leave. I only have to leave at 10 to 8.
Oh, okay. So not gone straight away. All right.
Yeah.
Okay. So, yep. So with your insulin dependent client, you'd be checking the foot for any damage, because the skin is more delicate. Be paying more attention in your treatment to the pancreas and all endocrine glands. I can't think of anything else. I haven't got the answers in front of me.
Is it the liver as well? Because that also affects the insulin, like the glycogen.
Yeah, the whole of the digestive system as well, perhaps, as well as the endocrine. Yeah. Big, yeah. Because I gave you a whole section with the scenarios and which reflexes to work, didn't I? Yes, there is a lot of stuff. Okay, foot in plaster. What would be the obvious thing to do?
Contraindication.
You
Work
do
on the hand.
Yeah.
Yeah.
hand on the
Hand.
side. That's
One hand, one foot, or both hands. Attention to the parathyroid, because that's working, that the parathyroid being responsible for calcium production, repairing the broken foot. So on bottom of page 2, I have written the reflexes, specific reflexes.
yeah.
You wouldn't need to know all of them. Let me try and find the answer. Sorry.
Is thyroid, parathyroid on your hand like this? The pinching action between because on the foot, it's between the big toe and the next. So is that what thyroid, parathyroid is? It's the parathyroid.
It must
Yeah,
be. I can't think of hand. Sorry.
Yeah, because it's in on the foot, it's between the big toe and the
The
first.
first, zones
Good.
1 and 2.
Yeah.
Yeah. So would it be like this if you're doing it on your hand, if they were doing it on themselves?
I would imagine, yeah.
No?
Or just working the neck area, because obviously it's in the throat, the thyroid.
Uh-huh.
It's just around their thumb, the
Okay.
base of the
Yeah.
thumb.
Okay. If someone had a corn on the top of their toe, what would you say to them about the corn? See a podiatrist.
Yeah.
Sorry. I'm sorry, I've kept you for so long. I think we're probably should be coming to the end now. I mean, these are all the specific reflexes, and they're just learning them really.
Yes. Where does
So the
it
skin,
go?
going back to the insulin dependent, might be bruised, infected. Just checking the skin, really. Those are all the things that you can mention, but really just checking the health of the skin. Further revisions. So these are all, as I said, I'm not going to go through them because they're all in the handout for specific reflexes. If you need any, or if you've got the charts, the reflexes on the feet, and if you're going to do a practice, I don't know if I said in class, practice, perhaps time yourself just so you know how long it takes you. And I think I've said before, when you've got the blank feet, just divide them into the 5 zones.
Right.
And maybe the diaphragm, waistline, heel line, just with a light pencil before you start, and then you can plot them in a lot easier.
Right. That's a good
See,
advice.
yeah, I've seen people do it, and then it's too high, crossing it out, and the kid, so if you just put the zones in, that does help. Oh, we've come to the end. I know I did just whiz through that the last few pages, but they were just, as I said, the specific reflexes, and I think you've all had the brain
Yeah,
is
getting
full.
tired now.
Yeah, of course,
Been a
it's
busy
late.
day at work. Yeah.
Yeah, same.
So obviously, like I said, reach out. And so yes,
Yeah.
we will. I've forgotten the date. Sorry, what was the date you finish? You're back after Sonia after your.
I'm off work from the 27th,
Okay,
and I think I'll for about 3 weeks. So
fine.
Yeah.
Okay, well, perhaps within a couple of days of then we should have a chat and see. We'll
Yeah. Okay.
sort something out.
Yep.
So yes, I will support you all as much as I can, and you'll all get there. We just might have to, tweak
Oh,
a few things or extend or.
I do have a quick question, Holly, if that's
Yes,
all right.
of
So,
course, of course.
Jane, you said is no longer making the cream.
Yes.
Has anybody resourced? I mean, I've still got
Oh,
quite a lot of cream.
did I send you we've got the association got their study day on the 8th of March in Rockingham. Where?
Yes.
Yeah.
I
I
got that
wasn't
email,
sure.
yes.
Did I send it to you, Sonia? I
Yeah.
mean, it's
You
obviously
did. Yeah.
right because I didn't know if you joined as student members as if you were on the mailing list. But anyway, I was reading the info about the day, and there is a lady called Sarah Hoey, and she makes creams because it said there's going to be discount on that day.
Okay.
So I will, and her business is, and she's only in Joondalup, which is near you.
All right. Woohoo.
Well,
Handy.
when I send I can't remember the name of the business. It's got Blossom in it. Sorry, my brain's gone to sleep now.
That'd
I'll
be
write
right, 'cause I'm not sure if I can get on to that Sunday yet, but I'll see.
no, but I mean, I'm just saying
Yeah.
I forgot she did creams, and so she does a whole range of lotions and creams, and yeah, just on the agenda for the day, it just said trade table, and there's a
Right.
discount offered to members, and that made me think, oh gosh, maybe I can. So I can well send the Zoom link, and I'll send just her link for her business with her creams, but I know a few people who've used them, and so I just thought, but obviously you might have found other cream.
No, that's really helpful. Thank you, Holly.
I don't know of any costs. Maybe I'll speak to her, see if we can get a discount for the Perth school.
Yes.
Yeah, I'll try and talk to her.
Please, can you explain to me about that? It says bring your own chair and set up your own area. Like I was a bit like, what? What do I have to bring?
Yeah, so
On the WhatsApp.
Can I rush off?
See you. Bye,
Sorry.
Sandy.
Thank
Bye,
you so much
Sandy.
for everything. I appreciate it, and I'll speak to you soon.
Good to see you. Bye.
Thank you. Bye.
So I obviously missed that. Someone said to me, what's the own chair? Is it just like a normal chair or a reflexology? And I obviously didn't read that bit. So
And
it
said
must
bring,
mean, because
yeah,
they're going to
it's,
do a swap, I think, aren't we?
mm, I don't know. I mean, maybe you can if you want to, but it says bring your own chair and set up your own area in your teapot and something else. And
All
what was it?
right.
Oh, I must ask Holly what that is. Like, yeah, they're not
Teapot?
gonna teapot.
Okay, I'll find out. I need to speak to Christina, the
Okay.
director, about something, and I need to find out then before. We've got a couple of weeks. It must
Yes.
be
So
something to do with one of the speakers. I know it's on toxins, and
yes,
maybe we're going
the
to be
lady that
having.
does herbal teas or something. Yes. Yeah, and she's going to have a little prac time. That's what it says in the program. Yeah.
Oh, Sandy and Holly, sorry, the other quick question I've just realised I need to join the Reflex Association because is that a reduced liability insurance at the moment when we're doing case studies, or I don't need that to do case studies?
Sorry, so you're saying, so you can join the association if you want free as a student,
Yeah,
but you don't have to. But once you've joined, then they put you on the mailing list. And
that's
sorry, that's
right.
not really the question.
No,
No.
sorry, I think I've
So
asked
you
two questions. So, but do I need to have my public insurance while my public liability for doing
no.
case
To
studies? No.
join as a student, no.
No, and
You,
to
you
do my case studies, I don't need that public at this point in time.
no, you don't need it.
Okay.
So it's when you join as a professional full member when you've passed the qualification,
Yeah.
and then you want to go either just join as a professional member or you're a student and you're being
Yeah.
upgraded. Then they want to see your insurance,
Right.
your first
Okay.
aid cert, and your qualification. But obviously,
Sure.
I tell them that.
I just keep
No,
forgetting.
so I mean, people
Yeah.
haven't got insurance when they're doing case studies,
Okay.
because usually it's just usually their friends and family.
Yeah. Yeah.
I
Okay.
think
Cool.
you can get, if you went on the website Gallagher do. I think one lady got it as a student because she wanted to. Obviously, the people she was working on, I don't know, she felt she wanted to. So I
Yeah.
think there is but not a requirement, it's a
Yeah.
choice.
Okay. Cool. No worries. Thank you.
Okay,
Thanks, Holly.
thank you. Lovely to
Thank
see you all,
you.
and yeah, I thank you for your time, and obviously get in touch and we'll be in touch, Sonia, and if anyone
Yeah.
else.
Yes.
Nice to meet you, Cindy and
Yeah.
Jackie, and good luck for your
Yes.
exam.
And nice to meet you too.
You'll be
Thank you.
surprised when you see Cindy because you don't know what she looks
Yeah.
like. She'll be a big reveal.
I'm a mystery. Yeah. I'm a bit. Yeah. There we go. Mystery.
Mysterious woman. Okay. Well, thank you, ladies.
All right.
Thank
Thanks
you.
so much.
Bye.
See you,
Bye,
Jackie.
Sonia.
Bye.
See you.
Bye bye.